assurance are you giving us now from, let's say, as far as this month is concerned, are we sure that this cholera of a disease will be subsidized?
Inshallah. In Bida, local government and its environment will subside. As all hands are being put on deck, both the health workers and even the political office holders, including the state governments, by providing interventions and sensitization to all the community. Because it's not only to give drugs. We don't pray that everybody will be going to the hospital to collect drug. We want to see whereby there is no even anybody again going to the hospital because of the condition. And that is why we are making a lot of sensitization. The health team of Bida Local Government, Niger State health team, including the governor himself and the commissioner. Thank you.
That we ourselves will be disseminating this message and information to. What are the things they are not supposed to do and things they are supposed to do to subsidize this cholera of a disease?
Yes, thank you very much. One of the things they don't supposed to do, they don't stop infection. By so doing, when they visit them, touching where they were lying down, it can even contaminate their hand, and when they get back to the community, they are able to spread it across. That is one. Secondly, we'll have to intensify sanitation. Intensification of sanitation in the sense that you will maintain both personal and environmental hygiene. That having been done, we talk of OD, what we call open defecation, and that is one of the problems. Turn downwards, it's being recorded that children here do defecate openly, and that is another causative agent for this very infection. Then we talk of the boreholes we have here, at least intermittently. They suppose there is what we call, I'm not an expert in borehole activities, but there is what we call flushing. We need to flush our boreholes maybe once in a year or so. And to intensify sensitization, we need a lot of support, in which the director have earlier said not to draw you back. The emir supported us with a van, that is ambulance. So I use from my own unit as the health educator of Bida Local Government, I use my town houses to go around the community to place in the ambulance with their megaphones, and others go with their foot on pedestrian, and they start the sensitization. And the type of message they give is to create awareness that they should sanitize their environment and they should avoid open defecation, and further to that, they should also try to wash their hands before eating and even after eating.
Also soliciting for the help of His Excellence to come to our head to have to sanitize Bida on environmental sanitation, so that after the whole sanitation we'll do a flag off. I will now fix a day in each month, so that sanitation will take place every last Saturday of the month in Bida Local Government. That is our pleading to the government to please. I want it to be done urgently. Thank you.
Even it's every last Saturday of the month,
yes,
is for sanitation, whereby everybody will be inside their house cleaning environment.
Department of Public Health. So far, so good. The plan we have so far, the strategic plan we have so far in the state level, we come up with a robust plan to how to curtail this public health menace as a cholera outbreak. Right now, not Bida per se, other 11 agencies are incorporated, making 12 in the state, yeah, which it's a major public health concern, which we not, yes. But the little part we have taken so far, committed, which through the calm leadership of the Honorable Commissioner, which is Dr. Mustafa Jibrin, is passionate and a kind of major concern, having a sleepless night on this outbreak of 18. We make sure that yes, we as a state epidemiologist, we as a team, as a state health educator, as a team, state DSNO, state laboratorian and nurses that are involved, actively involved as a state team, to make sure that we have even the briefing, reporting what is happening and update, to make sure so that we know this next step to follow on this public health measures that is ongoing as a cholera outbreak. Yes, but majorly our major concern is the Bida, because the incident rate is more highly in Bida. Yes, exactly, than other places. Yes, okay. So and that is why we are here. Sensitization is one of the best parameters used to create a public awareness, and that's why we want to carry out this storming to go around all these key strategic places to make sure that yes, we create awareness using our using these prevention measures, sensitization, prevention and control, telling people to know how to go about to maintain what is called personal hygiene, and that is why we're here. Thank you very much.
Okay, down on my knees praying now.